Transportation, Director General Yang Wenzhang from NHC, Director General Huang Xin from China Railway Corporation. They will take questions on the return of work by the migrant workers. We also have with us Dr. Guo Lixin, the Chief of the Endocrinology Department of Beijing Hospital. Let me first give you some updates. Yesterday, between 0 and 24, China's mainland reported newly increased confirmed cases 99, newly increased fatal cases 28, or in Hubei, and newly increased suspected cases 99. Yesterday's newly increased cure and discharged cases 1,678, close contacts removed from medical observation 4,771, and the severe cases dropped by 248. By the end of yesterday, China's mainland reported that now there are confirmed cases 22,177, including 5,489 severe cases. In accumulative terms, the cured and discharged cases numbered 55,404, fatal cases 3,070, confirmed cases 80,651, and existing suspected cases 502. In accumulative terms, close contacts traced 672,458, and close contacts still under medical observation 26,730. For Hubei, newly increased confirmed cases 74, all in Wuhan. For cured discharged cases 1,502, including 1,157 in Wuhan. The newly increased fatal cases 28, including 21 in Wuhan. Now there are confirmed cases 21,239, including 19,011 in Wuhan. For severe cases, there are 5,359, including 5,028 in Wuhan. In total, 43,468 cases are cured and discharged, including 28,511 in Wuhan. For fatal cases, in total, 2,959, including 2,349 in Wuhan. In total, confirmed cases number 67,666, including 49,871 in Wuhan. Newly increased suspected cases 47, including 46 in Wuhan. Now there are suspected cases 301, including 256 in Wuhan. Yesterday, between 0 and 24 o'clock, the newly increased reported importation of confirmed cases 24, including 17 in Gansu, 3 in Beijing, 3 in Shanghai, and 1 in Guangdong. By the end of yesterday, in total, the confirmed cases imported from overseas numbered 60. From Hong Kong, Macau, and Taiwan, the confirmed cases reported 162, including 107 from Hong Kong SAR, 10 from Macau SAR, and 45 from the Taiwan region. Outside Hubei, the confirmed cases numbered 25, imported cases 24, increased suspected cases 52, and there's no new fatal case, and the severe case has dropped by 19. By the end of yesterday, in Wuhan, the confirmed cases has been dropped to double digits, and the national total dropped below 100. And 9 provinces and Xinjiang Production and Construction Corp have had a 0 case increase for 14 days in the running, and with the people back to work and the increased risk of overseas importation, we need to keep alert and never slacken our efforts. So these are some of the updates. Now we will have the Q&A. Please focus on today's theme and put forward your questions. First of all, please identify yourself. The first question, please. On the right, on the second row. Thank you. From China Media Group, CNR. At the moment, the migrant workers are coming back to work. Premier Ke Qiang points out that there should be point-to-point arrangement to facilitate such a returning. So, what are the measures adopted by the MOHAs for such instruction, and what are the plan for the next step? We will have DG Zhang to answer the question. Thank you for your question. Every year after the Spring Festival, migrant workers are coming back to the urban areas to look for job opportunities. This year's situation is a little bit different, and migrant workers are postponing. They are returning to urban areas, and there are some new situations in the urban employment market. MOHAs have set up certain measures to facilitate the back to work by the migrant workers, specifically from the origin provinces. We need to know the situation, while in the destination areas, try to understand the situation, the demand better, and match the two, the supply and demand. And up to now, about 10 million job opportunities have been announced online, and also we set up an information platform online. Up to now, we have set up two major online platforms. One is for enterprises, and the other is for the migrant workers. For companies or enterprises, they can get access to the platform and fill in their demand, while the migrant workers can use the WeChat mini program to the app to fill in their information. Now, about 60,000 person times of employment information have been released on the information platform, and it is fair to say that these two information platforms have just been put into operation, and we recommend the relevant stakeholders to utilize these information platforms. Furthermore, we are also helping the low-risk regions to accelerate their resumption of work and provide more convenience to migrant workers in looking for a job. Let's continue on the left. On the front row, the First Lady reporter. Thank you. I'm from China Transportation News. I'd like to ask a question about the transportation of the migrant workers. How about the latest development in terms of the point-to-point chartered services? And for the differentiated and precision measures, how to realize that in the transportation of the migrant workers? We will have Dr. Cai to answer your question. Thank you for your question. To ensure the safety in the transportation and accelerate or help facilitate such back to work is our responsibility.
Door-to-door, one-stop chartered transportation services might be the best choice in the context of the epidemic response. Ministry of Transportation prioritized the returning of migrants, and we've made solid efforts in the following aspects. First, we made precise survey into the needs. We collaborated with the Ministry of Human Resources, National Health Commission, and the local party committees to make the survey and understand the needs of the migrant workers, so as to provide precise services. Second, we've set up dedicated transportation services. Bus, train will be dedicatedly used for the transportation of the migrants. We made rational and reasonable arrangements of the transportation routes. Third, we also stepped up the efforts in the prevention and control of the epidemic because we need to strike a balance between the transporting of the migrant workers and the continuous prevention and control of epidemic. We had contextualized risk-zoned guidance. You can find the guidance on our website, but there are several core points. First, the workplaces and the dormitories must follow contextualized and risk-rated arrangements in high and medium risk regions. 50% of the transportation capacity is utilized so that people can sit with certain distance and minimize the opportunity of infection. Besides, we ensure the one-stop service without any stopover, without taking in other passengers, so that it is door-to-door, from point to point, from the home of the migrant worker to the workplace. Fourth, we have also set up an observation zone. Once there is any immediate situation, we must take the migrant workers into observation. Also, we require all the passenger migrants to wear masks. Meanwhile, we ensured convenient transportation. We have set up faster tracks, no stops, no checkups, and no pay tolls. Priority lanes were given to these migrant passenger transportation vehicles. We've also set up a hotline to accept the questions, to take questions. To ensure the safe arrival of the migrant workers, we need logistic and technical methods to realize the goal. Currently, across the country, Sichuan province, Zhejiang, Shandong, Fujian, altogether 27 provinces have set up the chartered door-to-door transportation service. In particular, in Sichuan province, Ministry of Transportation rolled out the successful experience from Sichuan province. Across the country, the door-to-door one-stop service has provided 80,000 transportation times, and we transported 1.7 million migrant workers. We've also set up some dedicated train services, chartered train coaches. By early February, according to our estimate, we will have completed all the transportation for migrant workers to going back to their workplaces. Next question, please. Journalist from the second row on the left side. Thank you, from Hong Kong China Review. We've noticed that there are now dedicated transportation trains and train coaches for transporting migrant workers back to workplaces. I'd like to ask Director Huang Xin from China Railway Group to give us more details. Thank you for your question. China Railway Group prioritizes the returning of workers and facilitating the resumption of business. We have given full play to the role of railway in long-distance transportation. Apart from the normal schedule, we've helped local governments, Ministry of Human Resources, and enterprises in providing door-to-door, point-to-point transportation services. Since 16th of February till the 6th of March, we have scheduled 246 dedicated trains with a total transportation of 270,000 migrant workers. Recently, we have set up 99 trains for the transportation of migrant workers. And this covers 20 plus provinces as far as transporting people from Gansu in the northwest to the southeast Fujian province. And we cover 3 regions: southwest Yunnan, Guizhou, Sichuan to the Yangtze River Delta, Po River Delta, and from Henan, Hebei to Yangtze River Delta and Po River Delta. To do a better job in the large-scale transportation, we've made efforts in following 3 aspects. First, we set up a working mechanism with all the sub-companies. We have set up working groups on the dedicated trains. We collaborated with human resources department of different localities. Second, we made precise arrangements. We looked at the needs of transportation, dedicated train carriages and the trains were used in parallel, and we used a normal speed train and the bullet trains to provide door-to-door one-stop service. There is no stopover. Third, we made well-managed and orderly connection. We collaborated with the local human resources department and business for buying the train tickets and the exits and entry at the railway stations. There were group purchases by the companies, and there were faster lanes set up for the migrant workers so that they don't have to stay or crowd in a certain area while they were waiting for the trains. The train stations were also well disinfected and ventilated. Temperature monitoring was conducted, and a random temperature check was conducted on train. They sat with spaces between and among themselves. We also used the radios and the video to broadcast epidemic prevention and control knowledge. We guided the migrant passengers to wear masks throughout the ride. We've also set up a quarantine zone to take in fever passengers, if any. And down the road, we'll continue to step up services as such. Thank you. Next question, please. Journalist from the second row on the right side, please. Thank you. From the Workers' Daily. Some migrant workers have applied for the point-to-point service. Should they go through physical checkups and NAT tests before they can get the service, and who will bear the cost for the test? I'd like to ask DG Yang Wenzhuang from National Health Commission to take the question. On 19th of February, National Health Commission, along with the 5 ministries and departments, issued a notice. Before returning to work, health commissions need to provide guidance on 3 fronts. First, publicity on the health education, in particular on the migrant people in villages, to enhance their epidemic prevention awareness and capacity. Second, prior to their trips, temperature monitoring must be conducted. Third, make full use of the e-governance data services for the confirmed patients, suspected patients, and close contacts. Check online to have the initial screening and cut off the transmission from stopping the outbound travels. Currently, all the work has been well managed. From the national authority, the migrant workers don't have to issue such a health declaration card. They don't have to go through NAT test. They don't have to pay for temperature checks.
As far as I know, in Sichuan, it is stipulated for people who have stayed in the province for more than 14 days and who have been subject to the local management. If they need to migrate to other provinces for work, then they can go to the local clinics to get the body check, and they can be given a health certificate, and all of such services are provided free of charge. But I also want to mention that we need to guard against the increasing risk of epidemic spread, and we should always keep alert against the potential spread. The relevant containment requirements must be strictly applied by. For the various management services offered for the point-to-point or door-to-door migration of the migrant workers, they should always guard against the risks, and we should adopt a scientific approach to have the well-targeted and practical requirements. There should be no further burden on the local people and the migrant workers. Let's continue. On the right, on the third row, the gentleman there, please. Thank you. From China Labor Security News. How many migrant workers were back to home for Spring Festival, and how about their returning rate? What are the localities that have done fairly well in this regard? Thank you for your question, and we will have DG Shang to answer the question. Thank you. In China, there are 290 million migrant workers, and 175 million need to migrate to other provinces. Compared with previous years, we can see that as most of the migrant workers go back home for Spring Festival, and usually the 2 weeks right after the Spring Festival are the busiest time for migrant workers to return to work. This year, because of the epidemic, such return peak has been postponed. Now, it is fair to say that the relevant efforts are being made according to data available. Up to now, 78 million migrant workers have already been back to the urban areas, accounting for 60% of the migrant workers who were back home for the Spring Festival. Also, we can see mainly the migration took place in the Yangtze Delta and the Pearl River Delta. Guangdong and Zhejiang provinces have over 70% of the resumption rate, while in Jiangsu the percentage was about 60%. Let's continue. On the right, on the third row, the first reporter. Thank you. From China Media Group, CCTV. We recently learned that when taking the door-to-door transportation services, the reimbursement ratio is changing every day. Previously, some government authorities requested that the enterprises should be responsible for the fares. So, are there any specific policy guidances in this regard? We will have Mr. Cai to answer your question. Thank you. This is a very important question, as this is about the personal interest of the migrant workers. Migrant workers are important bread owners of their families. So we need to ensure the smooth safe and convenient transportation, and also the affordability of the transportation. We've already worked out some policy measures. First, we strived for the local government's support to such chartered services with financial policies or subsidy policies. We wish to reduce the transportation cost for the migrant workers. We also encourage the relevant financial policies, and the business owners or the entrepreneurs are also encouraged to share the burden. By doing so, we wish to reduce the cost of transportation for the migrant workers. Secondly, we adopt various forms to subsidize the transportation cost. At the moment, we have businesses who are directly paying for the transportation cost, and also we can find some localities the governments can have a cost sharing. For example, in Taizhou, Zhejiang province, and also some localities, the local government directly pay for the cost. Also, there are companies in Zhejiang and Shandong who honored their corporate social responsibility and paid for the transportation cost. But indeed, due to the variety of the local capacity, we can see the out-of-pocket expenditure for the migrant workers in terms of the transportation cost vary across the country. We cannot always emphasize that the government will provide the services or the company require the companies to pay for the cost. We also expect the cost to be shared by the society, including the migrant workers. So indeed, we hope that by cost sharing, we can reduce the cost of transportation for the migrant workers and realize win-win. We would like to call on the companies to take the initiative and have more corporate social responsibility honored, and the migrant workers can be back to work as early as possible. Thank you. Thank you. Let's continue. On the left, on the third row, the third reporter, please. Thank you. From Economic Daily. My question is about the health QR code. Some people mentioned that the health QR code is not commonly recognized across the regions. So mutual recognition becomes a problem. Can we have a harmonized health QR code? We will have Dr. Yang to answer your question. Thank you. Yes, indeed. This problem exists, and there are several reasons behind that. First, provinces may have different response levels to the risks, and also there are standards to generate such QR code are different. Some follow the national standard, some generate such codes based on the self-declaration or the local transportation. So the health code can only reflect the then health status and cannot have the function of health prediction. As you know, COVID-19 is quite unpredictable, and there is a big challenge in terms of containment. So it needs the close collaboration between the origin and the destination locations. In practice, there are also provincial or municipal health codes which there are discrepancies or inconsistencies. So on the one hand, we believe that it is not appropriate to have multiple codes. but on the other hand, we haven't had the harmonized environment.
The country government provides the data services for risk control. Provinces can look into the national database for confirmed and suspected cases, the database for close contacts, and the county-level risk database. Basically, there is the sharing and mutual recognition of these basic data among the databases. On top of this, the self-reported data from the citizens. There will be more precise management on different risk-rated people so as to support people movement. Currently, within the province, data can be shared. Meanwhile, we also support inter-provincial data sharing. For example, the data sharing between Hunan province and Guangdong province, between Sichuan province and Zhejiang province. Provinces have signed agreements on the MOUs of labor services and set up a health information mutual recognition system. And such efforts and practices are worthy of recognition and can be learned from. Next question, please. A journalist from the fourth row on the left side, please. Thank you. With the CCTV group, I'm interested in the migrant workers' transportation. 246 dedicated trains have been provided to the migrant workers, but we've also noticed that there are some pockets of transportation needs from the migrant workers. So how are these pocketed needs met? I'd like to ask Director Huang Xin from China Railway Group to take the question. Yes, indeed, there are the pocketed transportation needs, and this, when added up, is of the majority. Railway transportation is usually the first choice by migrant workers. Influenced by the epidemic since February, transportation vehicles, railway and trains included, have seen a sharp decline in the traffic. We've reduced certain trains from our original schedule, but in light of the sharp decrease in traffic, we have been focusing on meeting the needs between the homes of the migrant population to the most needed workplaces, cities. Since February till now, we have provided services to 50 million person times of transportation needs, and most of them come from the migrant workers. There are also sporadic pocketed needs, and we've been using the railway digital platform to closely monitor the movement of these people, in particular the traffic outflow and inflow into the most needed regions. And we've adjusted transportation capacity according to the analysis results. Every day we make an adjustment to meet the needs of the migrant workers. As we gradually stabilize the traffic, and as we see the increase in the traffic, we've restored some of the stopped services. We believe these can better meet the needs of the passengers, migrants included. In the transportation, we also follow strictly the prevention and control requirements, including disinfection of the stations, temperature monitoring, the spacing among passengers to ensure safe and well-managed transportation. We also like to ask the passengers to make good self-protection and support the train attendants to implement the protection and precaution measures. Thank you. Next question, please. Journalist from the fourth row on the left side, please. Thank you. With Xinhua News Agency. The door-to-door transportation services were targeting at a portion of migrant workers. How many migrant workers have received such services? And for the next steps, there will be bigger needs for transportation from the migrant workers. Will that mount the difficulties? Thank you for your question. DG Shang Jianhua will take the question. The door-to-door service was arranged and the centralized deployment, which was made by 5 ministries and departments. We had specific plans. The door-to-door service are focusing on satisfying the needs of the migrant workers who have been working at the workplaces for a long time or who have just found a job. In particular, we serve the regions where there is a high need for migrant workers to resume their operation. Localities have set up a specific implementation mechanism to implement the door-to-door services, the chartered buses, the chartered carriages, and the chartered railways. There are also chartered flights. The exporting and importing localities organized such transportation. There were also such services organized by businesses. Up till now, diversified transportation forms have provided transportation services to 2.63 million person times. Health was checked, transportation was safeguarded, and the whole transportation ride could be traced. So it was completely door-to-door from home to the factory. Great achievements have been scored, and down the road we need to deal with problems, such as the mutual recognition of a health QR code. Sichuan, Guangdong, Zhejiang, Anhui provinces have assigned MOUs for the mutual recognition of health QR codes. And in the future, we will continue to improve the coordinative mechanism, better understand the needs of the migrant workers, and ensure the mutual recognition of health information in a well-managed way, implement prevention and control measures, and ensure the safe returning to workplaces. We will also work with the poverty alleviation departments, and 50 poverty-stricken areas will be the focus of our service. The South, the East, and the West China counterpart assistance will cover more migrant workers from the western part where there were poverty-stricken counties. Next question, please. With Phoenix TV, some migrant workers said they have to be quarantined for 14 days and they have to pay a high price for that. For those who have taken the door-to-door services, do they have to go through quarantine, and who will bear the cost of their quarantine? I'd like to ask Yang Wenzhang to take the question. According to the 5 interagency guidance, as long as there is no symptom in the door-to-door service, the migrant workers can go back to work as quickly as possible. They don't have to go through quarantine, but if they show certain symptoms, they have to be under medical observation and or quarantine. And for confirmed and suspected cases, those should be admitted, must be admitted. Those should be treated, must be treated, and the treatment cost will be borne by the country government. The cost generated in the quarantine process will follow the locality standards of payment. We also suggested that the migrant workers should have a higher awareness of precaution, understand the risk level of the destination, and the level of emergency response and alert. They should better understand the epidemic prevention control requirements from the community they live in, the enterprise they want to go to, and if they go to the destination, they need to follow the regulations of the locality. If the passenger has a history of exposure to a high-risk people or group, the area, they need to report immediately.
And they have the obligation to take the quarantine. Let's continue. On the left, on the second row, the lady reporter, please. Thank you. From China Media Group, the CCTV Finance Channel. In East China, the producers of daily necessities and protective devices are still faced with the problem of inadequate supply of labor forces. So what is the solution to that, and what's the plan? We will have a DG Zhang to answer your question. Thank you for your question. Now, the key companies are expanding their production, and indeed they have an increasing demand for workers. And we find that there are difficulties in terms of the supply of the labor force, such as the transportation bottlenecks and etc. The MOHAS has set up a daily guarantee system. In this system, we have dedicated staff to provide facilitation, and we offer the daily account or daily deliberation of services. We have several key measures. The first one is to ensure the key companies like the major producers and exporters of the products, to ensure their demand for workforce is satisfied. And second, we help companies to recruit workers. At the moment, this percentage has been about 70%. And also, we support the balance for supply and demand of workforce. Thirdly, we provide support to subsidize the workforce. For businesses who are helping such work resumption, they will also enjoy the subsidy. This mechanism was established on February the 15th, and by the end of yesterday, the human resource authorities at different localities have helped 298,000 person times to be back to work. And for the next step, we will implement the subsidy policies and implement the various facilitation measures to support the normal production. Let's continue our Q&A. On the left, on the fifth row, the second lady reporter, please. Thank you. From China News Service. Some netizens mentioned that the door-to-door chartered transportation vehicles have the normal seating arrangement, so this is not there's not enough spacing, and the question is about this kind of arrangement. And do you have any doctors to go along with such transportation services? We will have Dr. Fan to answer your question. Yes, indeed, we are not aware of the situation that you have just described. For the door-to-door chartered transportation services, they are the seatings are arranged as usual, and the railway authorities are supporting the chartered services, and it is not open to the public. And also, the seating satisfies the requirements, and for some of the chartered services, there are doctors on board, and we support the relevant arrangements. I've just made a rough calculation. And the rough calculation found that in each carriage, only about 60 passengers. So I think the distancing requirement is satisfied. Furthermore, the quarantine is conducted following the relevant requirements. And in case of people who need quarantine, they would be sent to the next stop for quarantine. And also, the chartered trains will be disinfected according to the procedure, and the relevant information will be delivered to the relevant authorities. Due to the time constraint, last two questions, please. On the right, on the fifth row, the gentleman there. Thank you. From Shenzhen Satellite TV. We know that as companies are accelerating their resumption of production, some migrant workers may choose to take the high-speed trains. However, for high-speed trains, they are fairly closed for air circulation. So what are the disinfection measures and the ventilation measures? Now we'll continue to have Mr. Huang to answer the question. Thank you for your question. For the high-speed train in China, we have the onboard air circulation, which can continuously provide fresh air, the cleanness of the air, and other technical parameters can satisfy the national standards. In order to contain the potential spread of the virus, we have optimized the circulation or ventilation for all the carriages. We ensure the maximum fresh air supply. So 17 to 33% of extra fresh air are provided. So for the high-speed train, in every 5 to 10 minutes, the internal air can be exchanged totally. And also we have increased the filter net, the frequency to clean the filters to ensure the adequate ventilation and disinfected fresh air. Last question, please. On the left, on the front row, the gentleman, please. Thank you. From Chinese Family News. At the moment, the international epidemic situation develops very fast. We found that outside Hubei, most of the all of the newly increased cases are imported ones. So how to guard against the potential importation and virus spread? Thank you for your question. Virus respects no border, and the difficult times bring out the best of humanity. Just as you have said, in some countries, the epidemic situation is grave and severe. This has also increased the risk of case importation for China. So the Ministry of Transportation has followed the overall arrangement of the government and has made earnest efforts to guard against the potential importation. And we try to provide more convenient and sound services to passengers travel from abroad. We increased information sharing together with the relevant authorities like railway, the ports and the customs, as well as the immigration. We have set up the information sharing mechanism
so as to understand the identity information of Chinese nationals, their health status, their stopovers, their destinations, and other information, so as to give us some reference when we design our transportation plan. Second, we have categorized transportation plan. We've guided different localities to set up fleets with the bigger, smaller, and middle-sized transportation vehicles. We provide door-to-door, one-stop services on time and with good quality to ensure passengers arrive their destinations. Besides, we've also set up the monitoring and epidemic prevention and control along the route. We follow the requirements from high-risk rated places to disinfect the stations and provide guidance to the passengers. Fourth, we select good vehicles, good drivers, and good routes. Avoid stopovers and avoid any other passenger that is not for the implementation of the task. Thank you. With that, we have concluded today's question taking. Now I'd like to invite Physician Guo Lixin from the Endocrinology Department of Beijing Hospital to give us some health knowledge. Thank you, Mr. Moderator. I'd like to answer some of the most frequently asked questions related to diabetic patients during the epidemic. First, most people stay home, and we tend to eat more, and we tend to have snacks. We have less exercises. So what if the diabetic patients cannot control glucose well? We suggest that during the epidemic prevention and control, we recommend appropriate diet, balanced diet and nutrition, and to improve the immune system. At the same time, we should avoid over-intake and overweight. We need to have regular rationed meals and avoid the food that may increase the blood glucose level very quickly. Avoid fried food, and soup first, vegetable later, and finally, green. We suggest diabetic patients to chew slowly while they take their meals for better control of blood glucose. If the blood glucose level is not stable, they should avoid snacks. But if blood glucose is kept well, then among two meals, they can choose nuts and snacks like this, because for nuts they have multiple vitamins and unsaturated fat acid, which may protect the cardio and cerebral vascular of the diabetic patients. Second, since we stay home, there is less outdoor exercises. We suggest diabetic patients to have some home and indoor exercises like shadow boxing, aerobics, yoga, or any other favored exercises with a moderate intensity of not less than 150 minutes per week. If the diabetic patient is young, then we suggest 90 minutes of more intense exercises. 30 to 40 minutes of comforting exercises or force exercises for younger diabetic patients without comorbidities. We'd also like to emphasize 2 points: no alcohol, or minimize the alcohol intake. Exercises should be conducted incrementally. Second question was that during the epidemic, people feel anxious and nervous. They tend to sleep more during the day and they were sleepless at night. Will this impact the blood glucose control, and how should diabetic patients monitor their blood glucose during the epidemic? Nervousness and anxiety is an emotional